Welcome back to Midday Kentucky, everyone. Well, we have a story for you. Dr. Eric Smith, General and Bariatric Surgeon over there at the Georgetown Bariatric and Advanced Surgical Offices. How are you, my friend?
I'm good.
I've got to get straight to Brittany. How are you? Welcome to the show.
Hi, thank you.
Brittany, for the last few months we've been talking to Dr. Eric Smith and discussing surgeries and options that he performs over there. Let's talk about you and your amazing results. First of all, what type of surgery did you do on Brittany to begin with?
I did a robotic sleeve gastrectomy on Brittany.
Okay, just briefly tell us, what does that involve?
So basically, like we've talked about in some of the other shows, we're reducing the size of the stomach. You know, I like to say we take the stomach and kind of turn it into the shape of a banana. We reduce the capacity of the stomach down to about an eighth or a tenth of what it was before, and remove about 70 to 80% of the stomach.
Okay. So we're going to pop up some before and after shots here, Brittany, okay? So first of all, I want to just ask you, before you had this surgery, where were you at? What led you to make the decision?
Well, I was 385 pounds, and then I lost 30 on my own, and I gave myself a goal of losing 50 before summer, or I would look into something. But I'd never been into doctors because they always said that your problem is because you're overweight, whether you were there for the flu or whatnot. So I knew somebody that had went there, so I finally got the nerve to go to a seminar, and so from there.
And what we're looking at right now is, how much have you lost in total, my friend?
In total is 185.
I'm completely blown away. Now, you've told me about these type of results before. Everyone sitting at home is sitting there. When you see a visual of someone losing that amount of weight, you know it's possible.
Yeah.
Okay, it's not a reality TV show. This is real life. How do you feel now after knowing you were carrying around 180 pounds?
I feel amazing. I didn't realize how bad I felt before.
Really?
Yeah.
Health issues before the weight loss?
Well, she can tell you all the things that she dealt with beforehand.
Well, luckily, all I had was high blood pressure. But I knew that I was just a ticking time bomb for when it would be diabetes and heart disease.
Yeah.
Because it ran so strong in my family.
So talk to me a little bit about when you decided to go ahead with the surgery. What were your thoughts? What were your expectations for Brittany? Do you say you're going to lose this amount of weight in your consultations, or it's an open dialogue?
You know, I think the first thing is to find out what their goals are, because you want to make sure their goals are realistic.
Yeah,
you know,
realistic.
And there's data that we can look at on how much excess weight someone will lose at 1 month or 1 year or 2 years out from surgery. And so you want to make sure, and sometimes people maybe aren't aiming high enough, and you want to know what they want to get out of the surgery. And you need to make sure that they're willing to put in forth the effort, and that's exactly why she is where she is right now.
And self-control?
It's very hard. The surgery doesn't do it for you. People think that, oh, you're having weight loss surgery and it just happens. No, it might give you the first 20 to 40 pounds, but I really feel like anything after that is what you put into it.
It's lifestyle. And it's the tools that Dr. Eric and his team give you over there at the hospital to maintain that and to continue to do it on a healthy lifestyle. Yeah?
Yeah, they give you the push that you need to know that it's long term and not just some quick fix.
It's forever. Dr. Eric Smith, I just want you to touch on very quickly, what are some of the issues of health issues being overweight? Now, we know high blood pressure. We're acceptable to diabetes.
So hypertension, diabetes, sleep apnea are three big ones that we deal with, we see, and those are close to about 90% curable with weight loss surgery. Other things, fertility issues for women.
Yeah.
You know, polycystic ovarian syndrome, obviously things like arthritis, other skin problems, but there's coronary artery disease, high cholesterol. There's things that shorten patients' lives that if they're able to lose adequate amount of weight with surgery, that they can reverse those conditions.
Okay, look, we're going to put up all the contact information up on the screen now. There it all is there, Georgetown Bariatrics and Advanced Surgical Services. Very quickly, on there, if you want to go on and have a look at, you know, what is possible, you have videos on there that people can look at and find out a little bit about the services.
Correct, absolutely. They can go, there's a place where it says to get started.
Yeah.
There's a BMI calculator on there where they can calculate their BMI to see if they qualify. There's numbers to contact people to ask about coverage from their insurance.
Yeah.
There's actually videos on there of the surgery that we perform as well.
I think it's amazing. Brittany, I'm so proud of you.
Thank you.
I've done many of these shows and seen people do amazing results. Keep up the good work. You're an inspiration. Thank you for coming in
Yeah,
and sharing the
absolutely.
story as well. If you want to find out more information, you saw the information up there just a moment ago.